Sir, it's audible. He is going live now, sir.
We are live now, doctor. You can start, Prahlad.
Hello, good afternoon, everyone.
Yes, good afternoon, sir.
Hello, Prahlad. You can start introducing the doctor. Hello.
Yeah, I can hear you.
Yes, doctor. Okay. 1 minute. Let me call Prahlad.
Hmm.
Yeah, very good afternoon. I welcome everybody for the Facebook live session on kidney health today on the occasion of World Kidney Day. It's my privilege to introduce Dr. Harisha Babu, consultant nephrologist and transplant physician at Sparsh Hospital, Infantry Road, Bangalore. So I would like to thank Dr. Harisha Babu for taking time on his busy schedule. Sir, over to you, sir. I request all participants,
Uh,
if you have any queries, put it in chat box. Doctor will take all the queries at the end of the sessions.
yeah, thank you, Prahlad and Dr. Reddy's lab for providing me this opportunity. So, on the occasion of World Kidney Day, World Kidney Day is celebrated on the second Thursday of March every year to bring in awareness about the kidney diseases among the general population. So, as you know, kidney diseases account for a huge burden of disease in the society. So, to this is mainly to bring in the awareness of the kidney diseases in the general population. As we know, as we know, the most important causes of kidney disease is the diabetes and hypertension, and followed by, of course, specific glomerular diseases are there. The first two important causes for kidney damage are poorly controlled diabetes and poorly controlled blood pressure. So all diabetics and blood pressure patients are at risk of getting kidney damage if they don't control their blood sugars and blood pressure optimally. They are at high risk of getting their kidneys getting damaged. So that is why the good control of blood sugars and blood pressure is very important. Then we have many other kidney diseases like glomerular disease and interstitial disease, which are per se kidney diseases. I mean, their basic origin is in the kidney, so they have to be identified at a early stage, and proper evaluation has to be done, and early treatment has to be initiated so that the kidneys don't get damaged. What are the most important causes of kidney disease? The most important thing about the kidney disease is kidney disease. One of the unique feature of kidney disease is kidney disease does not manifest with major signs and symptoms until unless more than 90% of the kidney gets damaged. So that is why there is a large delay in the diagnosis of kidney disease. So that is why regular routine medical checkup becomes very important. very important in identify the kidney disease at the early stage of the disease, so that further damage to the kidneys can be prevented. So that is one of the most important thing. So if somebody is having blood pressure and blood sugar, so then they have to optimally control it, because the kidney damage occurs over years. So once it is damage is done, it is a permanent irreversible process which cannot be reversed. So that is why control prevention is the most important thing. So to identify, there are what are the symptoms, early symptoms and signs. There are few symptoms which are attributable to the kidney disease. Some of them are early morning puffiness around the eyes. When somebody wakes up in the morning, they notice that there is periorbital some swelling is there, and as the day progresses, this periorbital swelling, that is eye swelling, reduces. And also there is appearance of swelling of the legs. So we call it as edema. The swelling of the legs, this generally appears by the evening, or when somebody is travels or standing for long time. So this swelling in the legs appear. So these are the one of the signs, few symptoms of kidney disease. And then also they have decreased urine output, and breathlessness and walking. These are breathlessness and walking. These are the symptoms which occur in fairly advanced kidney disease. And also there is increased tendency for urination in the night. So that is also one of the important symptom of kidney disease. And if somebody is not able to lie down flat in the night, so that may be one of the symptoms because of the fluid overload in the body. So these are some of the important symptoms of the kidney disease. So any symptom is there, especially if somebody is more than 60 years, and if somebody is having diabetes, long-standing diabetes, blood pressure is there, then we need to uh, they need to consult a physician or a nephrologist for and has to be evaluated with kidney function tests, and also urine examination, so as to see the level of the kidney function, and also any protein leakage in the urine. So if there is protein leakage in the urine, one of the symptoms is increased frothiness in the urine. So that is if the protein keeps losing, so there is increased frothiness which is complained by the patient. So this is also one of the important symptom of kidney disease. If any such symptoms are there, they have to consult the physician or the nephrologist at the earliest, so that like evaluation can be done, and early identification of the kidney disease can be done. And if it is detected, we can take appropriate measures, and further damage to the kidney is prevented. Because once the kidney is damaged, that is once the chronic kidney disease, that is permanent irreversible damage to the kidney is established, then that is a irreversible process, so that cannot be reversed. Not all kidney diseases are all not all kidney diseases are permanent damage. There are two types of kidney failure. One is the acute kidney failure, and the other is the chronic kidney disease. In acute kidney failure, especially occurs in following a gastroenteritis or some drugs, or whenever there is a lot of blood loss, or post-surgical. So these are the situations where the kidney function is previously normal, and temporarily there is a shutdown of the kidney function. So once that initiating event is taken care of, and there is gradual recovery of the kidney function. So that is acute kidney injury. So there is a potential for complete recovery of the almost complete recovery of the kidney function is there in acute kidney failure. Then we have a chronic kidney disease, which is a slow, progressive, permanent destruction of the kidney function, where there is irreversible damage to the kidneys. So this is a irreversible process, and this cannot be reversed. So the only way is to prevent the chronic kidney disease is like what is the cause, to identify what is the cause for leading the chronic kidney disease, that is the diabetes, hypertension, or glomerular disease, which needs to be appropriately managed. So, and once the kidney disease, there are in chronic kidney disease, there are various stages of chronic kidney disease based on the GFR. This GFR is calculated based on the serum creatinine value. Serum creatinine is approximately considered 1.2 milligram per deciliter is considered as a normal value. Anything above 1.2 milligrams, anything above 1.2 milligrams is abnormal. So it varies from lab to lab and method of estimation. So most of the labs consider 1.2 as the upper limit. As the as the kidney damage as the kidney damage worsens, there is gradual increase in the serum creatinine value. So people do ask, is there any method to decrease the serum creatinine value? Actually, serum creatinine is a marker of kidney damage. Whenever so it just indicates how much the kidney is functioning. If the creatinine is normal, we presume that kidney is functioning normally or optimally. If the underlying kidney disease is there and it is not functioning optimally, then there is a slow increase in the serum creatinine. So now the target is not the serum creatinine, but the target is the kidney function, that is the underlying kidney disease, which has to be identified and managed. And once there are, as I told you, in chronic kidney disease, there are various stages. Stage 1 to stage 5 is there. Stage 5 is when the patient is put on dialysis. What happens when the kidneys fail? The kidneys fail. Whenever there is a permanent destruction is there, so the patient has to be on dialysis. If it is an acute thing, then temporarily till the recovery occurs, we have to support with dialysis. And once the recovery starts occurring, then no need to continue the dialysis. In permanent damage, when CKD stage 5 and beyond, either the patient has to be on dialysis for rest of the life or has to undergo something called as kidney transplantation. So in dialysis also there are two types of dialysis. One is the hemodialysis or the blood dialysis. The other one is the peritoneal dialysis. Other one is the peritoneal dialysis, or we call it as in layman term we call it as water dialysis. So the greatest advantage of peritoneal dialysis is it is done at home. There's no need to visit the hospitals frequently. So that is one of the advantage of peritoneal dialysis. Of course, renal transplantation provides the greatest quality of life. It almost provides the near normal life um, uh, in a patients with kidney failure. So that is the ideal treatment for all patients with kidney failure and dialysis. Of course, there are situations where the kidney transplantation is not possible, like somebody is above 60, 65 years and other comorbidities are there. So then they may not be fit for kidney transplantation. In that case, dialysis will be the only option available to the patients. The most important things one needs to know to protect the kidney health is for a normal general population is they have to drink at least 8 cups of water, that is 2 to 2.5 liters of water has to be taken, and the ideal body weight has to be maintained. I mean, approximately the body weight, obesity should be prevented, body weight should be maintained as near as possible. And if already somebody is a diabetic, the blood sugar should be optimally controlled. And if somebody is having blood pressure has to be optimally controlled with the lifestyle modification and also with the drugs. This is these are the most important things. And one of the other most important thing is the kidney stones, which also affect the kidneys. So kidney stones generally does not these kidney stone diseases causes. This is the only disease where there is pain. Otherwise, no. Rest of the most of the other kidney disease does not have any pain. So until unless we investigate with the blood test, it is difficult to identify the kidney disease. So kidney stones are the ones where the patient will have likely to have a severe pain. If there is a small stone which has entered into the ureter, so they will have small stone. Then they will have to consult, and appropriate investigations like ultrasound or CT scan is done to identify the cause for the stone, and based on the size and site of the stone, the appropriate measures are advised. So this is overall regarding the kidney health and kidney diseases. So God has given us two kidneys. Kidneys are approximately kidneys are approximately about the size of their own fist. If you see the size of your fist, that will be approximately the size of your kidney. So approximately about 10 centimeter in length and about 150 grams by weight. But the most important, one of the most remarkable thing about the kidney is about 25% of the blood pumped by the heart directly goes into the kidneys. So kidneys do a lot of background work. So not only involved in the filtration, it is also involved in the bone health. It is also involved in the in the production of the blood. All these are all and also involved in the acid base metabolism. So these are all the most important functions of the kidney. And whenever there is a kidney damage, so all these functions are affected, and the parameters related to these functions get altered if we do the investigations. So I'd like to, this is briefly regarding the kidney disease. If you have any questions, I'll be happy to answer. One question is there. Doctor, which food is good for kidney health, vegetarian or non-vegetarian? So, see, basically, any food, main thing, most important thing is the maintaining the healthy lifestyle. Healthy lifestyle has to be maintained. If somebody maintains a ideal body weight, so that would be the most ideal thing. So regarding the once vegetarian and non-vegetarian, both are fine. If it is a normal healthy adult, both can be taken, but maintaining of the ideal body weight is the most important thing. So that is most important, and unhealthy fast food, junk food needs to be avoided. Non-vegetarian, if the kidney functions are within normal limits, non-vegetarian food is also fine. So as long as you are taking healthy food and leading a healthy lifestyle, maintaining ideal body weight, that should be okay. The most important thing is the maintaining the healthy lifestyle. Most of the fast foods or junk food contain lot of sodium monoglutamate, which is used as a preservative used as a preservative. That is why they provide high sodium content. So this sodium content is detrimental to the kidney health. So these all these fast food, junk food, tinned, canned, stored food, all this food should be avoided as far as possible, and maintaining eating green leafy vegetables, fruits is good for maintaining the in a healthy adult. This all this I am saying in a normal healthy adult. Things are different for if somebody is already having a kidney damage, then the things would be different based on the damage, how much to the extent of the kidney damage. Those based on the parameters of the kidney function, things would be different. One more question is there. What would be the initial signs that indicates kidney might not be working as expected? It's a very good question. So, as I told you, so a large proportion of kidney should get damaged for the symptoms to come. So most of the times major symptoms may not even come, even when the kidneys get damaged to the extent of 80 to 90%. So the initial signs are one is the leg swelling, and leg swelling as the day progresses. The other is the periorbital swelling around the eyelids, especially in the early morning. When gets up in the morning, so there will be periorbital swelling. So this one, periorbital swelling and leg swelling, and generalized weakness, loss of appetite, extreme tiredness. These are certain symptoms of kidney disease. But these symptoms may not come until till advanced renal failure occurs. So that is why relying on the symptoms may not be ideal. So hence regular medical checkups are advised, so that the kidney disease can be identified at the earliest stage. So if you ask me the symptoms, the one is the eyelid swelling and leg swelling, weakness, generalized weakness, loss of appetite. These are some of the signs of pointing towards the kidney disease. One more question is there. How would the kidney infection cause? Kidney infection. See, kidney infection generally we call it as the lower tract infections are called as there can be kidney infection can be in the from the upper tract or the lower tract. The upper tract infections, that is the kidney infection per se, is called as pyelonephritis, and the lower urinary tract infections are called as urinary tract infections or cystitis. So generally, in case of females, because of the short length of the urethra and also due to the vaginal opening, the urinary tract infections are one of the most important causes of most important frequent causes of infection in case of females. And in case of males, especially if somebody is diabetic, they are more prone for urinary tract infection. One few important symptoms are burning while passing urine, fever with chills. Sometimes there can be blood in the urine, or there can be flank pain. These are the important symptoms of urinary tract infection. Uh, the kidney stones, whenever there is a kidney stone is there, that can also, as it passes through the ureter or urethra, so they can cause injury to the mucosa and also can give rise to infection. So that also we need to keep it in mind. It is good to see one of my uh, transplant patient, Deepak Biswas. He got transplanted about 10 years back with under my care. So kidneys are God has given us two kidneys. So unfortunately, whenever it fails, both of them fail. So as diabetes and hypertension affect as systemic diseases, so it will affect both the kidneys. So that is why that we have to maintain the kidney health. So unfortunately, when they get damaged, both of them get damaged. Very rarely one kidney gets damaged. That is mainly due to the obstructive causes. So one kidney is sufficient to lead a normal life. 1 in 1,000 are born with only one kidney. So and they are not even aware. Many of the times they are not even aware. As long as that one particular kidney is working normally, so it is sufficient to lead a normal life. Many a times, when they undergo routine medical checkup, they will come to know about only one kidney being present. Uh, one kidney is sufficient to lead a normal life, but unfortunately, whenever there is a kidney damage, so both the kidneys get damaged. So, we have to be careful and prevent the kidney damage. So the most important thing is maintaining the healthy lifestyle and maintaining the body weight, ideal body weight. That is the most important. Prevention of the obesity. So that is the most important thing. So we have to, if we can lead a healthy lifestyle and maintain the ideal body weight, the chances of development of diabetes and blood pressure, as we know, these are all lifestyle diseases. So this can be prevented if this is prevented, and the chances of kidney getting damaged are also prevented. So if somebody is not if somebody in a general population, the most important thing I would suggest is to maintain the healthy lifestyle, healthy food habits, and regular medical checkup. One more question has come. What protein is recommended for dialysis? In dialysis, in fact, in dialysis population, we recommend about 1.2 gram per kg per day. So the normal protein requirement for a general population is about 1 gram per kg per day. In CKD, we restrict it to 0.8 gram per kg per day, so that there is a decreased load to the kidney, failing kidneys, and it is the kidney underlying kidney function is maintained for a long time. Once the patient is initiated on dialysis, they will require the more protein intake, because there is a loss of protein during dialysis. So to prevent that, for hemodialysis patients, they require about 1.2 gram per kg per day, and for peritoneal dialysis patient, they will require even more, about 1.4 gram per kg per day. So the requirement is more. So they will require high protein, and they will require a high biological value protein, preferably from a animal source. So what I suggest for all my patients is to at least to have two eggs every day. Dialysis patients at least to have 2 eggs every day, and also to have non-veg at least 2 to 3 times a week, so that the malnutrition is prevented in these dialysis patients. Because it is seen that malnutrition is directly related to the mortality in dialysis patient. If adequate nutrition is not maintained in dialysis patient, their likely survival and dialysis is greatly reduced. So that is why the nutrition is of very paramount importance in dialysis patient. So they will have to take a high biological value, preferably from a animal source. So another question has come. For diabetic patients, is it compulsory that their kidneys will affected at the end, or they can maintain kidney health with diabetes also? Yeah, it's a very important question. Not all diabetic patients will have kidney disease. So if somebody can control their diabetic status, they need not worry. If it is kept under fairly under good control, their kidneys is not likely to get damaged. So control of blood sugar is of very much importance. The HbA1c, it is recommended that 3 months average blood sugar, that is the HbA1c, has to be maintained around 7. So that has to be maintained. If somebody can maintain the blood sugars and blood pressure under good control, so their chances of their kidney getting damaged is very less. So maintaining the diabetic status, that is of most importance. It is not that all diabetics will have end up with kidney damage. Only diabetics and hypertensives with very poorly controlled blood sugars and blood pressure will end up with kidney damage. Not all of them.
I think there are no more questions, doctor.
Yeah.
So we can close. I think there are no more questions as of
Yeah.
now.
Yeah.
Yeah, thanks a
So,
lot, doctor, for your time for our Dialysis TV and sharing your valuable thoughts
yeah.
on kidney disease for our audience. Thanks, doctor.
Thank you very much.
There's one more question, doctor.
Yeah. One more question is, what is the animal protein for vegetarian person who is on dialysis? Uh, this is a common practical problem we face day in and out. They can take paneer. They can if somebody is a vegetarian, they can take paneer. If they are not able to meet even with if the from vegetable source proteins are not meeting the requirement, then we will suggest nutritional supplements. Nutritional supplements are available. So if there is deficiency from if there is deficiency of protein from the vegetable sources, still they require that extra protein is required, then we can always give the nutritional supplements. There are many nutritional supplements available, especially made for dialysis population. So those things can be supplemented to maintain the nutritional requirement in dialysis population. So it is a very challenging thing, especially for a vegetarians. This is a very challenging thing. So whatever paneer and other stuff can provide, that can be used, and whatever shortage is there, that can be covered from the nutritional supplements. Now many nutritional supplements. Various companies have brought out various nutritional supplements, ideally designed, specifically designed for dialysis population, with more protein, less calories. Such supplements can be used in this dialysis patients. So the most important, if you ask me, what is the most important message I would like to give for the general population is everyone should maintain healthy lifestyle. So that is the most important thing. The body weight, the whatever we eat should be healthy, and more of fruits, and at least 8 cups of water should be consumed on a daily basis. So that is the most important thing. And if somebody is a diabetic or having blood pressure, so then the blood sugar and blood pressure has to be rigorously controlled. So, and of course, along with the lifestyle modification, medication would be required to control. HbA1c should be maintained less than 7, and blood pressure should be maintained less than 130/90. So if this can be maintained, the chances of kidney getting damage is greatly reduced. Uh, and the sodium intake should be reduced as much as possible. Generally, the typical South Indian diet contains about 15 to 16 grams of salt. So that is also one of the there's a question for which salt is recommended for dialysis patient. See, all salts will have all salts will have sodium. So sodium is the one which is determinantal to the kidney. So whenever there is a salt retention, along with it there is a water retention. So salt and fluid retention both is there. Yeah, there is all the some there are salts with potassium, so that is also not good. So salt intake, whatever salt you take, that has to be restricted. So 2 to 4 grams is the salt recommended in patients with kidney disease. If you see the typical South Indian diet, it contains as high as 15 to 16 grams of salt. So which is 4 times the recommended. So that has to be restricted. The salt comes mainly from the pickle, papad. They have high salt content. So those things has to be restricted. So there is no salt which is specifically recommended for dialysis patient. All salts are sodium chloride or potassium chloride. Some of them will have potassium. So the salt has to be restricted. Otherwise, whenever salt is taken in the excess quantity, there is along with the salt there is a retention of the fluid also. So salt and fluid retention is not good for dialysis patient. So in that case, if they want to liberally take the salt and water, then they will have to undergo the daily nocturnal dialysis. So that is the only way that to allow the salt and fluid intake freely in dialysis patient. If they undergo, there is something called as daily nocturnal dialysis. Means there are few patients who undergo this daily nocturnal dialysis. So in them, blood pressure, the requirement of blood pressure medicines is very less compared to the other patients who are undergoing two or three times a week. So that is the only way. Otherwise, salt has to be restricted in this set of patients.
I think there are no more questions, doctor.
Yeah,
Uh, yeah, I think we can close. There are no more questions. Thanks once again, doctor. Thanks for your valuable time for our Dialysis TV and
yeah.
sharing
Thank you.
the insights with the
Thank
audience.
you. Thank you, Dr. Redis, for giving me this opportunity. Thank you very much.
Yeah, thanks, doctor.